Hello, everyone. I am Julie Hallet, an associate professor of surgery and a pathobiliary surgical oncologist at the University of Toronto. I'm also the president-elect of the Society of Surgical Ergonomics.
Hi, everyone. I'm Jenny Shao. I'm a clinical assistant professor of surgery at the University of Michigan. I also chaired the Research and Applied Ergonomics Committee for the Society of Surgical Ergonomics.
So today we are diving in the world of ergonomics for robotic surgery, and we're hoping to unlock some tips to optimize ergonomics in order to prevent pain and discomfort for the surgeon, but also to make surgery safer for everyone involved, surgeons and patients alike.
So as an ergonomic researcher and a minimally invasive surgeon that does both laparoscopy and robotic surgery, I've really seen firsthand both the benefits and challenges that this technology can bring to the operating room.
Minimally invasive surgery has really transformed our field. I think we can all agree on that. It has offered immense benefits to patients and health systems, but it's also no secret that that has come at a physical cost to surgeons. I really like this 2010 survey by Adrian Park that was published in the Journal of the American College of Surgeons, mostly because of its very appropriate title that was Patients Benefit While Surgeons Suffer. So I think maybe we'll start this by looking at whether we know if MIS really presents difficult physical strains or discomforts or symptoms compared to open surgery.
So, minimally invasive surgeons can actually have more symptoms of pain than surgeons performing open surgery. So, in this 2018 meta analysis that compared laparoscopic versus open surgery, they actually found that minimally invasive surgeons had higher odds ratio for developing pain, especially in the neck, shoulders, hands, and legs, fatigue, and numbness compared to surgeons who do open operations. And while they demonstrated that the overall pain wasn't statistically different between MIS and open groups, surgeons performing these MIS operations were much more likely to experience these symptoms.
So, thinking about this, robotic surgery platforms have often been suggested to be better for their potential ergonomics advantages over, let's say, laparoscopy. Do you feel that the benefits are significant for robotics versus laparoscopy in terms of ergonomics?
Robotic surgery can definitely offer certain advantages over laparoscopic surgery. I think some of the ergonomics are a little bit better than conventional laparoscopy. I think the 3D view is great, and there's certain improved instrumentation and visualization. I think surgeons can also have the added benefit of working from a seated position and with instruments that allow for greater precision and certain range of motion. But I think these improvements really aren't without their certain trade-offs in which we really need to consider. So there have been some studies done that survey practicing robotic surgeons, and when you look at the percentage of robotic surgeons that report physical discomfort, that number is very high. It's still 56%. And I think when you delve closer into these studies, what you're really finding is that perhaps the workload is distributed a little bit differently in terms of laparoscopic and robotic surgery. And so perhaps during laparoscopic surgery, you're using a different muscle workload and activating bigger muscle groups versus the robotic operations.
It would seem then that while robotic surgery has certain benefits and address some ergonomic concerns from laparoscopy or even open surgery, it comes with potentially new ergonomic challenges.
So I think with anything ergonomic, really awareness is going to be key, right? So recognizing the risk and potential for suboptimal ergonomic practices, I think that's the most important part because really awkward positioning in the OR can happen anytime and it happens pretty often, especially during any kind of repetitive motion. And most of the time it's unrecognized. And so what we really want to do is pay attention to any repetitive motions that may happen that can lead to pain and then injury and potentially disability. So when you look at robotic surgery practices, what you find is that there's actually higher rates of lower back stiffness correlated with annual robotic volume and potentially even eye strain in robotic surgeons that have been practicing for 9+ years compared to surgeons with less volume and relatively new robotic surgeons, meaning that there's a lot of cumulative little effects from robotic surgery that we may still not yet know the full extent of. We also discovered that robotic surgeons who expressed higher confidence in regards to managing their ergonomic settings and who clutched often and weren't afraid to change certain features on the robot actually achieved better ergonomic control and reported lower physical symptoms.
Now, I'm sure a lot of surgeons out there are eager for advice. Do you have any tips on how to prevent or even mitigate the ergonomic risks in robotic surgery?
So right now, what I'm going to do is just go over the optimal ergonomic setup and things to do almost every single time before your case. I go through this with all of my trainees, and I find it to be super helpful. So the first thing that I have them do is actually sit down in a chair and adjust the height of the chair. I also try to find a chair with a back. Sometimes these can tend to be a little bit more ergonomic. And one feature that's kind of important is to make sure that the wheels actually lock. So sometimes you may have to switch around to different stools in the operating room before you find one that actually suits your height. I find that as a short surgeon, sometimes the chair height is actually too tall for me, even when it's at its lowest on the ground. So making sure that you set yourself up for success is really important. And so obviously the lumbar support so you can lean back during the surgery will help support your lower spine and hopefully decrease any risk of having that lower back pain as you increase your case volume. The next thing that I usually tell my trainees to do is really to adjust the arm height. And so here you're looking for optimal angles where your elbow is at 90 degrees. This should feel really supported. You shouldn't be tensing up your shoulders or feeling any strain whatsoever in your larger muscle groups. The next thing I look for is the console height. And so this is going to be sort of the height of the viewfinder as well, and just making sure that everything is set up well for when you're standing straight up and not slouching. Other things you can adjust are the foot pedal and what and how far it comes out towards your feet. And then so lastly, the viewfinder and the tilt. So I find that even though you can tilt 30 degrees and look down, that angle of declination is actually probably damaging to your cervical spine over long periods of time. So even though you can rest your forehead on the console, I think what's actually really beneficial is to make the viewfinder tilt as low as possible so you can sit straight up. And sometimes what I also do is I actually raise the console height just slightly. So I'm looking down more so with my eyes than with my neck. Just some overarching tips to remember is to really adjust your ergonomic settings every single time. I know that all of us have surgeon profiles that will then be stored within the robot itself. But I think because the chair we're sitting in may be different every time, maybe you're wearing different shoes, it's really important to go through these steps mentally and just make sure you're really adjusting things so you're comfortable every single time. And like I said, just the last minute tips where you're just going to adjust that console height just to be slightly higher to decrease that viewfinder angle and make sure you're making mental checks on yourself intraoperatively. A lot of times I'll remind my residents who may be in awkward positions, hey, do you feel like you need to clutch? And I expect my team members in the operating room to tell me that too. Sometimes I tell people if it looks awkward, you probably feel awkward. And that's when it's necessary. One last reminder is that in the operating room, when you're doing robotic surgery, sometimes we forget to take micro breaks. A lot of times it's easier to remember when we're doing open operations, but just because we're on the robotic console doesn't mean that you don't need micro breaks. So just make sure that you continue to do your stretches during longer cases, and especially finger and hand stretches to decrease stiffness.
And those are really such helpful tips to how to set yourself up at a console and make sure you're comfortable and reduce the risk of injury. There's also a few basic or ergonomic principles I think can be really useful regardless of the surgical approach. The first one, you alluded to that, Jenny, is the stretches. So don't forget about intraoperative micro breaks and stretches. And there's a set of those that can be done while sitting. So they're ideal for the robotic setup. And then also between surgery stretches can be really helpful. As we alluded to with the clutch for robotics, it's important to reset your posture during surgery. So just think about it once in a while. And if you catch yourself in a bad position, just correct it. And that can have a huge impact. And then finally, think about the whole setup of the operating room. Often, this is very prescribed and strict for robotic rooms, but just to make sure that some tripping hazards have been looked at, and that the setup is optimal for efficiency. And that leads me to my last point is about checking in with the team. So we're not alone in the operating room, sitting at a console, making sure that the people by the bedside, the anesthesiologists, the nurses have their ergonomics looked after. And more and more, there's this concept of ergonomics timeout that is being discussed and developed, such that part of the safety checklist also is making sure we have optimal ergonomics because it is crucial for our safety, but also the safety of our patients. So I think we've done a good review of why ergonomics are important in robotic surgery, as there can be some unique challenges related to this approach and some useful tips that people can use in their day-to-day practice in the operating room. Do you have any last words for surgeons out there who practice robotic surgery?
Just a reminder that taking care of our bodies is not just for our benefit, but for our patients as well. A healthy surgeon is precise and attentive. So let's embrace ergonomic practices with that same enthusiasm that we have for technological advancement and continue to optimize and improve what we can do in the operating room.